It began subtly, silently. A man in New York City, recently returned from a trip abroad, started experiencing unusual symptoms. At first, they seemed like nothing more than a persistent annoyance. But as the days turned into weeks, a terrifying truth began to emerge. He was infected with a rare sexually transmitted fungus, a previously unseen foe on American soil. The fungus, previously confined to the tropics, had crossed borders, carried unknowingly by a traveler. It was a stark reminder of the interconnectedness of our world, and the ease with which infectious diseases can transcend geographical boundaries. The man's diagnosis sent shockwaves through the medical community, raising concerns about a potential outbreak and highlighting the urgent need for awareness and preparedness. The emergence of this rare fungus in the heart of New York City served as a wake-up call. It underscored the vulnerability of even the most developed nations to emerging infectious diseases. The silent invasion had begun, and the clock was ticking to contain its spread. The patient, a man in his late 30s, had recently returned from a business trip to Southeast Asia. He had no underlying health conditions and considered himself relatively healthy. Upon his return, he began to experience a persistent itch in his groin area, accompanied by a burning sensation during urination. Initially, he dismissed the symptoms as a minor infection, perhaps a yeast infection, and self-treated with over-the-counter remedies. However, the symptoms persisted, and in fact, worsened over time. The itch became unbearable, and the burning sensation intensified, making urination a painful ordeal. Concerned, he finally decided to seek medical attention. At the hospital, doctors were initially puzzled by his condition. His symptoms didn't quite align with any common sexually transmitted infections. It was only after a series of specialized tests, including a culture of the affected tissue, that the shocking truth was revealed. The man was infected with a rare tropical fungus, a type of yeast known as Candida auris, typically found in Southeast Asia. Candida auris is not your average yeast infection. This particular fungus is known for its resilience, its ability to survive on surfaces and resist common antifungal medications. It poses a significant threat, especially to individuals with weakened immune systems, and can lead to serious invasive infections of the bloodstream, heart, or brain. The discovery of Candida auris in the US sent ripples of concern through the medical community. This was not just an isolated case of a rare infection, it was a potential harbinger of things to come. The fungus's ability to spread through contact, its resistance to common treatments, and its predilection for healthcare settings, where it could easily spread among vulnerable patients, made it a public health nightmare. The New York case highlighted the critical need for rapid identification and effective treatment protocols for Candida auris. It also emphasized the importance of infection control measures in healthcare settings to prevent the fungus's spread. This wasn't just about treating individual cases, it was about preventing a potential outbreak. The emergence of Candida auris in the US was not an isolated incident. This stealthy fungus had been quietly spreading across the globe for years, appearing in hospitals and healthcare facilities across Europe, Asia, and South America. Its origin remains unclear, but its impact is undeniable. Candida auris is a stark reminder of the interconnectedness of global health. What starts as a localized outbreak in one corner of the world can quickly escalate into a global threat, facilitated by international travel and trade. The fungus's ability to silently colonize individuals, spreading through casual contact and persisting on surfaces, makes it a formidable adversary. The global spread of Candida auris underscores the importance of international collaboration in combating emerging infectious diseases. Sharing information, tracking outbreaks, and developing effective treatment strategies are crucial to containing this fungal threat. In the fight against emerging infectious diseases like Candida auris, knowledge is power. Awareness among both the public and healthcare providers is paramount in preventing the spread and mitigating the impact of this fungal threat. For the public, understanding the modes of transmission, recognizing the symptoms, and practicing good hygiene, including safe sex practices, are crucial. It is equally important to be aware of the potential risks associated with international travel and to seek prompt medical attention if any unusual symptoms develop after returning from abroad. For healthcare providers, staying informed about the latest research, diagnostic tools, and treatment guidelines for Candida auris is crucial. Early detection and appropriate treatment can be life-saving, especially for vulnerable patients. The emergence of Candida auris in the U.S. is a wake-up call, a stark reminder of the ever-present threat of emerging infectious diseases. This silent invader, with its resilience, its ability to spread unnoticed, and its potential to cause serious illness, demands our attention. This is a call to action for increased vigilance, for a proactive approach to public health, and for a global effort to combat this emerging threat. We must invest in research, strengthen surveillance systems, and improve infection control measures. The fight against Candida auris is a fight for our collective health. It is a fight we must undertake together, with a sense of urgency and a commitment to protecting the most vulnerable among us. The time to act is now, before this silent invader gains a stronger foothold.